Okay, let's get started on today's webinar. I'm Terri Huffman with OptiMed Health Plans, and I appreciate the time you've taken to join our webinar this afternoon. We're going to talk about OptiMed gap plans, and the topics to be covered are medical gap in the marketplace, positioning strategies, medical gap in action, and why OptiMed. OptiMed gap. So what is OptiMed gap? OptiMed Gap is a fully insured group product that is a creative approach to cost control. Gap works in conjunction with major medical plans to fill in the gap of higher deductible and coinsurance. It provides first dollar coverage for increased deductibles or copays or coinsurance, thus lowering major medical plans premium and offsetting the rising out-of-pocket medical expenses. Premiums are typically tax deductible, and employee contributions are typically pre-tax, and benefits are tax-free. Gap is not AFLAC or indemnity or Medigap. It's not aftermarket or workplace enrollment product. In today's marketplace, especially today, there are numerous new trends, challenges, and expectations for you, the broker. The old medical plans with low deductibles and managed care plans with networks and copays have given way to the current Affordable Care Act plans with rising cost, rising medical conditions, and rising deductibles. So employees expect you, the broker, to be able to negotiate like you did before the Affordable Care Act. You're expected to do full employee meetings with less commissions. As you know, there are fewer carriers in the marketplace, and the only solution in many instances, if not all, is a higher deductible or coinsurance and or copay. So there is a need for alternative solutions and a diversity of results. OptiMed is the solution, offering new healthcare programs such as gap coverage, wellness plans, telemedicine, and voluntary plan coverage. OptiMed health plans integrate with underlying major medical plans, including level funded plans, as well as high deductible health plans, PPO, point of service plans, HMO, and health savings accounts. The benefits are assignable, so there's no waiting to be reimbursed. The provider can submit claims directly to OptiMed. The preferred method is electronically. This cuts down on processing time, or the member can submit claims to OptiMed via fax, mail-in, or upload to the OptiMed website. We do have an example on the screen of an OptiMed ID card. We provide these cards to all members. The member can present this card along with their major medical plan at the point of service, and each group with OptiMed Gap is assigned a group number. Employees and dependents receive cards, and the plan design for each group is on the front of the card with customer service and claim information and numbers on the back of the card. OptiMed Gap is a triple win. Gap helps maximize and optimize benefits. Employers can save money and increase employee satisfaction with lowering major medical premium, yet providing first dollar coverage for out-of-pocket expenses. Brokers, you get to solve clients' pain points by being creative and providing a win-win solution for employer and employee. The employee gets immediate coverage that they want and they definitely need. So how to position OptiMed Gap in the marketplace? The ideal groups that would want or need an OptiMed Gap plan have received a significant major medical rate increase at renewal time, groups that are looking to control healthcare costs, groups that want to return to first dollar coverage, and groups that want to provide healthcare relief for their employees. Medical Gap is a cost-effective benefit solution to rising healthcare costs. And as mentioned earlier, OptiMed Gap works best in conjunction with a high deductible health plan. And in lieu of its health savings account, OptiMed Gap provides coverage when designed around the major medical plan. Medical care cost trend for 2020 is projected at 6%, which is consistent with the 5.5 to 7% range of the previous 5 years. Yet average labor productivity grew only 1.1% over the last 10 years, which is lower than the 2.3% overage over the last 70 years. So employers want lower employee benefit costs without sacrificing quality. They want creative alternatives. They want higher quality benefits to attract and retain employees. So let's look at a premium cost savings example based upon a group of 150 members. The original or the current major medical plan has a $1,000 deductible, and the current annual premium is $1,131,566. So at renewal, this employer increases that $1,000 deductible to a $5,000 deductible, which substantially reduces the annual premium to $695,144. However, this employer decides to implement an OptiMed gap plan to help the employee absorb that additional increase in deductible. So they have in place a $5,000 inpatient maximum benefit with a $2,500 outpatient benefit maximum, and the annual premium for this gap plan is $176,856. So if you add the gap premium with the renewal major medical premium, that comes to $872,000. Subtract it from the $1 million plus annual premium, which gives you a substantial savings annually of $259,566. This is an example of employer savings by group size. Let's look at a small group of, say, 25 employees. The estimated major medical savings at renewal is $62,287, with the cost of a gap plan being $20,400. You subtract that from the annual major medical premium and you get a net annual savings of $41,887. Go to a larger group and see how, and you can see how this savings works even greater. You have a group of, say, 350 employees. Annual major medical premium is $641,500. With the implementation of an OptiMed gap plan, you have premium of $285,600 with a net savings of $355,900 on your annual major medical premium. Statistics have shown that 3 in 5 bankruptcies are due to medical bills. 24% of households have problems paying their medical bills, and the average employee medical out-of-pocket cost is $2,470, and with 63% of workers having an annual deductible of at least $1,000, if not more, and 76% of workers have high deductible health plans have an out-of-pocket maximum of over $2,500. And especially in this time, at this point in time, employers choose not to get medical attention when they need to because of out-of-pocket expenses that they simply can't afford or pay in many instances. So most Americans are living paycheck to paycheck, and employees want benefits that fit their needs and the needs of their family, benefits that are easily acceptable, usable, and affordable. The OptiMed gap plans help achieve this result. An article from Newsroom published in 2019 shows that healthcare workers or healthcare costs increased twice as fast as workers' wages over the last decade. On average, health spending by families with large employer health plans has increased 2 times faster than workers' wages over the last decade. And a Kaiser family Foundation Health Benefits Survey for the period 2009 through 2019 shows that employee deductibles has risen faster than workers' wages. As you can see on the screen, the orange line indicates deductibles goes from 2009 to 2019 with an increase of 162% when compared to the black line, which is workers' earnings, which has only increased 20%. And that's a wide disparity between the two. An example of actual claims processed by OptiMed will give you a better idea of how valuable this benefit is. Take, for example, an outpatient surgery for cyst removal. The allowable charges by the primary carrier are $1,075. And since that allowable charge was sent to the deductible or the co-insurance, the member's responsibility is $1,075. But since the employer implemented a gap plan and the benefit has not been exhausted, OptiMed will pay that $1,075, leaving the member with zero to pay, no responsibility. Look at a higher claim or more complicated claim of a 2-day maternity hospitalization. Allowable charges, again, here are $3,326. A portion of that allowable charge went towards deductible or co-insurance, leaving the member responsible for $700. They have a gap plan in place. So the gap plan pays that out-of-pocket member responsibility, leaving the member with nothing to pay and no responsibility for this particular claim. OptiMed's customer service is extremely friendly. We have excellent customer service with the availability of online accessibility. A member can go to www.optimedhealth.com, click on member, then click on claims. They can view a video that shows them how to submit a claim. They can print off a claim form. 95% of our claims are processed in 3 days, with clean claims being paid in under 2 days. And what I mean by a clean claim is a claim that is submitted either by the provider or by the member that includes everything OptiMed needs in order to process that claim. We do need, along with the claim form, an EOB, explanation of benefits, from the primary care carrier. So always include that. That is something we must need in order to make sure that the claim we receive has been covered under the primary major medical plan. 80% of our calls are answered within 30 seconds. We have automated claim status notification via email and access to claim status via portal. OptiMed sales strategies. As secondary insurance to a major medical policy, GAP can be purchased to fund inpatient services, outpatient services, or a combination of either or inpatient and outpatient services. Our GAP plans pay until either the annual maximum is met or the primary insurance kicks in. The maximum benefit amount is the major medical plan's in-network, out-of-pocket maximum that includes the deductible plus the co-insurance. And that's something that we would look at when determining which plans to quote for your client or prospect. OptiMed GAP plans are a guarantee issue with no health questions asked. There's no pre-existing condition limitations in our policy. The only time we would consider a GAP plan as pre-existing is only when the underlying major medical carrier indicates that the underlying major medical plan is pre-existing. Examples of OptiMed eligible expenses include inpatient coverage for hospital confinement due to injury, accident, and illness. We cover outpatient treatment while under the care of a doctor at the emergency room, urgent care center, physician's office, outpatient surgical and emergency facility, diagnostic testing facility, or similarly licensed facility. Pinpoint the plan that you want to offer to your group. Remember that the GAP plan is customizable, and the premium will go up or down depending on factors such as whether or not your GAP plan contains a deductible and the amount of the deductible. Most of our plans that are sold are first dollar coverage. They don't have deductibles. However, you can include one in order to lower the premium and make the GAP more competitive. Is the deductible applied to just the inpatient services or to both the inpatient and outpatient services? You can do that. What are the maximum GAP benefit amounts you're going to look at? Is there GAP coinsurance? Are doctor office copays reimbursed? And is there a drug benefit rider included? We can pay for outpatient prescription drugs when we include the drug rider. It covers drugs that go towards deductible. It doesn't cover copays for drugs. And it only covers brand name and generic. It doesn't cover specialty drugs. And this is an instance where the member does have to file for reimbursement with OptiMed. Comparing a GAP and an HSA plan. The HSA plan is where the employee basically takes the risk. And as I mentioned earlier, the carrier takes the risk with the GAP plan. It is insurance coverage. There's incidental reimbursement for the HSA account, and the HSA account can be spent incrementally, and the GAP is reserved for more significant events. There's protection up to the account balance with an HSA, meaning that if you don't have enough money accumulated in your HSA account, then you may not have enough funds to pay for all of your medical out-of-pocket expenses. With the GAP, the protection is up to the monthly maximum benefit of the GAP insurance. And an HSA is an isolated account, whereas the GAP is coordinated specifically around the underlying major medical plan of the group. 7 sales strategies for offering GAP. An employer can add higher deductible plans and add GAP to one or more of the plans. You can have a low deductible major medical plan that's more expensive, and then offer a dual option buy-up with greater out-of-pockets and lower major medical premium, and put GAP with one or both. You can offer GAP as voluntary option. In most instances, OptiMed requires 5 employees to be enrolled or 10% of the eligible group, whichever is greater. You can offer employer paid GAP. You can include GAP with an HRA or an HSA. We do have HSA compatible plans with a $1,400 upfront deductible. You can add a high deductible health plan with our prescription drug rider and have all your prescription drugs in the major medical plan go towards deductible instead of having them copay eligible. You can find the money to pay for GAP, of course, by lowering the major medical premium, which we saw in several examples. And you can replace an HRA or an HSA with GAP. So who is United Group Programs? We are basically a third-party administrator, TPA, specializing in specialty ancillary lines through our exclusive product line called OptiMed. So United Group Programs is a TPA, and OptiMed is our brand product name. The company was founded in 1968. We have offices in Atlanta, our headquarters, Baltimore, Washington, D.C. area, Philadelphia, North Carolina. We're a full-service TPA for medical GAP, MEC, limited medical, dental, vision, LTD, STD, life, critical illness, accident plans, level-funded major medical, HSA, FSA, COBRA administration. And we will be having additional webinars on several of these products in the near future. Brokers and agents can go on to www.optimedhealth.com and view videos for both sales and enrollment, along with product sheets that you can designate your own account information or contact information. So you can go onto this website, view the video, print off a gap brochure, customize your PDF, and the video is available in English and Spanish. Gap appeals for many reasons. It provides options for your clients. It reduces the need for other coverage. You set yourself apart from other brokers, demonstrating group and claim management. Gap is a creative solution for staying ahead of our competition or your competition. And it's an additional revenue stream. The OptiMed Gap Commission is a level 15% for new and renewal business. OptiMed Gap plans include always value-added non-insured benefits. These programs are included with OptiMed branded plans at no extra charge. We have telemedicine benefit with no co-pays, no limitations on how often a member can use the services. We have workplace wellness with Kelly services, advocacy and customer service, employee assistance programs, wellness advice, line staffed by nurses, COBRA administration, and POP only 125 comes with your Gap quote automatically. So how do you receive or secure a proposal with OptiMed? One way is you can contact me, and my contact information will be on the next slide, or you can go again to www.optimedhealth.com, go to Broker Center, click on the Request a Quote link, fill out the form, and submit it online, or you can print it and fax it to the number on the screen, or you can email it to proposals@optimedhealth.com. Please include always a copy of your major medical plan summary, a group census showing who's on the major medical plan and who's eligible, and if a group currently has Gap in force, please include the current plan design plus the current and renewal rates. Thank you for taking time out of your afternoon to join the webinar about OptiMed Gap plans, and if I can answer any questions, provide a quote, assist you in any way, please don't hesitate to give me a call at 866-494-5281, or you can reach me on my cell phone at 770-300-6000, and my email is terryh@optimedhealth.com. Thank you again for attending, and this concludes the webinar.